Hi everyone, my name is Dr. Whitney Strong-Bak and I am a licensed pediatric psychologist that specializes in working with young children. And today we're going to be discussing ways to explain the current pandemic to young children around ages 4 to 7 who really might be having difficulty understanding all the changes that are happening in their day-to-day lives. We'll review information to share, how to explain it in a child-friendly way, and what to do to help young kids cope in positive ways. So, how do we talk about this? What information should we share with kids? It's important to remember right now that your child is still a child, and they might struggle to understand information. Not all information is going to be helpful for them to hear, and not all children care about the situation. The most appropriate way to share information is to create an open environment where your child is free to ask questions, but doesn't feel forced to talk if they don't really want to. So when you're sharing information, we want to make sure So the first thing we want to do with any information that you have is to make sure that it's accurate before sharing it with anybody, especially young children. Young kids are going to get confused if we give them information and then later have to tell them it was untrue. So information from places like the Center for Disease Control and Prevention, the CDC, or the World Health Organization is typically reliable information in a situation like this. Information on the internet, on the other hand, can be based on people's opinions or uninformed sources, so be careful about trusting everything that you read there. We also want to make sure that we're being honest about information that we know for sure and information that we don't know. Even young children might eventually find out that something we said was untrue, and this can affect how much they trust what we say in the future. And so it's okay to be honest if a child asks you a question and you don't know the answer to it. You can let them know that's not something that we know right now, but here's what we do know. It also can be very tempting for a parent to want to provide comfort and reassurance, even if we're feeling pretty nervous ourselves. In doing so, sometimes we accidentally make promises that we have no control over, and we don't actually know whether or not it'll be true. So for example, a lot of people are tempted right now to promise their child that no one they know is going to get sick in order to give them that reassurance, or promise them that they'll go back to school before the end of the school year. But we want to make sure that we're avoiding making those promises about things that we can't control because we really want to protect the trust our child has in the information we're giving them. So instead, promise them that they're working hard to stay healthy, promise them that they'll go back to school and see their friends again someday, and you can pretty safely promise them that we won't have to stay in the house forever. We also want to make sure that the information we're giving our child is appropriate. Young children will have trouble understanding this situation. Information they get is going to need to be very clear and concrete. Some of the most important information you can share has to do with what this current outbreak is, how people get it, what are some possible dangers of it, and then what we're doing to protect ourselves. So, for example, we're going to share what this current outbreak is in child-friendly language. We might say something like, it's a virus that can hurt people's lungs and it makes it hard to breathe. It's more likely that adults get sick, but kids can get sick too. Keeping it very concrete and clear for them. In explaining how people might get it, we can say things like, people get it from being around other people who have it. Sick people coughing and sneezing can give it to other sick people, and even touching things that sick people have touched can make someone sick. If we're going to explain some possible dangers for a young child, we might tell them that the reason this is something we're worried about is because it's really easy to catch this virus. And we have to try to stay away from other people right now, like at the school or at a store. Some people don't know that they're sick. They don't have a cough or anything, but they can give it to other people on accident. And we're safe when we stay home and only see each other because we know that we aren't sick. And then anytime we're sharing some information about something that might be a little scary, we want to make sure that we're letting children know what we're doing to protect ourselves, what we're doing to stay safe, and how we're in control. And so we'll talk about what are we doing to protect ourselves. So an example of that might be other people doing things around the community and around the country. So that's why school's out right now and you're learning from home, and that's one way to stay safe. And a lot of places are closed that people like to go to a lot, like your favorite restaurant. And that's so people don't accidentally get sick. People are doing a really good job staying home and keeping away from other people right now so that no one gets sick on accident. And then at home, we're doing a really good job keeping ourselves safe too. So you're staying home with mom and dad and your brother and sister instead of going to school, even though you really want to go to school. And we wash our hands right away when we get home in case we touched any germs. And we're talking to grandma and grandpa on the phone or on the computer right now instead of going over to their house. And those are all things that are helping keep people safe and keeping people from getting sick right now. So it's really helpful to know that it is totally normal for a child to ask you to explain or repeat that information over and over again for them. Sometimes this is a way for them to process the information that's been given to them because it's new. And it can also be a sign that they're asking for you to reassure them. A way of seeking comfort can be to ask mom over and over again, tell me why we stay home and how that's keeping you safe. And that's a good opportunity for you to listen for any misunderstandings they might have and help fix them. So for example, they might tell you that every time someone coughs, that means they have the virus and they're going to get everyone sick. And that would be a really good time to gently tell them that that isn't true. And you don't have to say, no, that's wrong. You can just say, you're worried about that cough being a sign that they're sick. Well, don't worry, buddy. Not everyone who coughs has the virus. But it's really good how that person covered their mouth when they coughed to make sure they weren't spreading any germs. And that's how we cough now too. Another thing that's really helpful to remember right now is that information in the news is not explained at a child's level. And it usually involves images that can be really confusing or scary, or words that are really confusing or scary. And so consider shutting off the news so that you're controlling the information that your child gets. And also remember, you're your child's role model. They're going to look to you for information, and they're going to look to you for how to react to things. They're always listening to us. And it's okay for you to be stressed, and you don't have to try to hide that from them. Just be ready to tell your child what you're feeling and what you're doing to help yourself feel better. This way, you're modeling good coping skills with some of those uncomfortable feelings and letting them know that there's an okay way to feel something and express it rather than keeping it all bottled up inside. It's really helpful to know that we can talk about how we're feeling right now in this situation, and all emotions are okay. Young children in these situations have some pretty common reactions that we can predict. So a lot of young children are likely to react to stress with changes in behavior because they don't have the words to describe their feelings. That's why you're going to model helping them describe feelings. Behavior like more frequent temper tantrums, whining, clinging, all of those are really common. And you can help your child through this by maintaining routines, consistent behavior expectations to the best of your ability. And it's okay to recognize that these behaviors are related to stress, but still have a consistent consequence for inappropriate behavior or temper tantrums. The best thing would be to respond as you normally would to negative behavior, such as giving a timeout, but it might be seen as a sign that your child needs a little extra positive attention for what they're doing right or for any reason at all. Extra hugs, getting to be a special helper around the house, special playtime, and even an extra book at bedtime. All of those are really good ways to increase those opportunities to give your child that extra positive attention. We like to tell families for every one time we had to have a consequence for a negative behavior, we want to see 4 positive interactions for something that a child's doing right. So they're really feeling like they are getting positive attention and warmth from mom and dad and not in trouble all the time. Other common reactions might involve fears or losing skills that a child once had. Like we might see backsliding in potty training or eating, or more trouble falling asleep at night on their own. It might be really frustrating to be dealing with potty accidents again or sleeping trouble, but this is another sign that our children need an increase in understanding and support. We want to respond with increases in positive attention for behavior we want to see and avoid using punishment for not staying in bed or having potty accidents. Maybe consider revamping any reward system you used for potty training or sleeping in their own bed in the first place. And if it's acceptable in your family, maybe consider relaxing rules about where little ones sleep for a little while, and consider planning some calming activities to do before bedtime. So that, again, might be an extra book, some more cuddles, or maybe it's listening to music or saying some prayers, whatever your family finds comforting and has found comforting in other times of stress. And this is also a really good time to make extra time for family, especially for our little ones. Activities that can be really fun and comforting and helpful for your family that were stressful before. This is a really good time to make extra time for family, especially when you have little kids. Activities that have been fun or helpful for your family during stressful times in the past are great to try again right now. It also isn't a time to try to be perfect. Everyone is doing their very best to maintain some normalcy right now. So just take it day by day and be sure to find some time to take care of yourself. And the last information that I want to leave you with is how to know when you or your child might need a bit more support right now. So if you or your little one has experienced recently a loss or a serious illness of a loved one, we know this situation, the COVID-19 situation, can lead to excessive distress because the news or images on TV can trigger intense or long-lasting emotional reactions. And if you notice this in yourself or your child, it could be a sign that it's time to talk to somebody about those feelings. Similarly, if you find yourself or your child becoming preoccupied with worries or questions about getting sick, or experiencing a lot of negative thoughts that are difficult to control, especially if you find these thoughts or worries are interfering with your day, or you notice that your child is becoming overly fearful about separating from you or about you getting sick, talking with a professional could be really helpful. So, we want you all to know that support is available. We are still seeing people, and there are many providers in our area that are providing services like this via telehealth. And we also hope that this video can be helpful as well. Thank you guys, and have a great rest of your day.